about 63% of Californians have experienced at least one adverse childhood experience. And I'm sure most of you in this audience have heard of those adverse childhood experiences, the ACEs, and how critical it is to pay attention to them and to be asking about them in your work. No one is a bigger champion of bringing this into the conversation than our first Surgeon General, Dr. Nadine Burke-Harris. She's pictured here. If you want a good TED Talk about adverse childhood experiences and the importance of incorporating the conversation of trauma into medical practice and behavioral health practices, listen to her TED Talk. It's very good. When she was the first Surgeon General back in 2019, she led an initiative to make sure that we were talking about toxic stress, talking about trauma. Her goal was to reduce the rate of toxic stress by half. And what she did, the way she did that was she worked with our governor and with ACEs Aware, which was the first organization to really champion a tool that the state of California created and encouraged people to use to ask about trauma. And the way they encouraged it was they provided training. So in order to use this tool, you have to get certified. You have to go through a training, but then you can use it, and you get paid for using it with families who have Medi-Cal. They pay $29 for each time the measure is used. And this is a really important and pretty easy way of asking about adverse childhood experiences. Keep in mind, we're asking about events here, situations like the ones you guys listed in the chat. This ACEs Aware website has a lot of information about, just in addition to the training, about other resources that are available. So I do recommend looking at that website if you want to learn more, if you want to see the tool that's there. Go to the next slide, because this is the tool that Dr. Nadine Burke-Harris kind of helped bring about. It's called the PEARLS, the Pediatric Adverse Childhood Experiences and Related Life Event Screener, or the PEARLS. And really what this is it's a 2-page tool that has the original adverse childhood experiences, those questions that talked about traumatic events, so childhood abuse, childhood physical abuse, sexual abuse, and neglect. And that's on page 1. And then page 2 is some other factors that are known to cause stress and traumatic reactions. And they're particularly topical, I think, in today's world. So I'm really glad that those were added on to the original ACE questions. And those are things like discrimination, neighborhood violence, and also resource care or foster placement. So again, this is a tool that we use in our practice with every single patient. What's nice about it is that originally, and those that are familiar with the ACE surveys and how those were used, originally this was done and actually started here in San Diego by Dr. Vincent Felitti in the 1990s. And he was using it with adults and asking them retrospectively about their childhood. And that's how the tool began. Since then, it's really changed a lot, and we've started asking questions when children are younger. So there's a version that you can use with birth to age 11, and then another version for age 12 to 19.